Good afternoon, Romania. Thank you for this invitation. So today I will be giving you a brief overview of the implications of COVID-19 and the diabetic foot in Malta. So, as you know, the World Health Organization has declared COVID-19 as a public health emergency on an international concern. During the COVID-19 outbreak, the diagnosis of the disease was complicated by the diversity of symptoms which a lot of patients were presenting with. Until now, we know that skin findings reported and associated with the COVID-19 infections remains very sparse. We know very little about them. There is still much for us to learn about the novel coronavirus, even with regards to the wide range of symptoms. Although we know that most of the common symptoms are cough, fever, shortness of breath, loss of taste, loss of smell. However, the literature has also suggested that there could be also foot problems, and these including are what was known as the COVID toes. Many viral infections are known to produce skin changes, and whilst there has been an increase in some evidence suggested a link between certain aqueous skin lesions and COVID-19, we still do not have any conclusive evidence that all those being observed at the moment and associated with COVID-19 infections, although skin manifestations have been reported up to 20% of COVID patients. So COVID-19 infections induced chilblains have been observed during the pandemic and communicated amongst French researchers, Spanish researchers, Belgian researchers, UK researchers, and other dermatological networks. A team of researchers from Spain, France, Belgium, Portland, Oregon have studied the toe and skin infections in relation to COVID-19. And in a case reported in the Journal of the American Academy of Dermatology, they concluded that it is of utmost importance for dermatologists, podiatrists, all healthcare professionals to recognize these together with other symptoms of COVID-19. And basically, this was what a lot of countries have reported seeing together with other symptoms, which is the COVID toe. And again, here are diagrams which foot lesions, which also were seen very commonly in people presenting with COVID-19. A lot of publications have been, we've seen a lot of publications in the literature also reporting these cutaneous manifestations, which one is seeing amongst these patients. So what is the COVID-19 situation in Malta? Like in other countries, especially around Europe, deaths are always on the increase. This is a report of 2 days ago. We have around 200 cases, 250 cases a day, and about 3 to 5 deaths a day, which indeed is a lot for a small island with a population of less than 1 million. And how has this affected the podiatric profession in Malta? As Professor Bolton has said, like in the UK and in America, we had closure of podiatry clinics for a period of time, approximately 4 months, no podiatric service at all. We had closure of clinical biomechanics clinics, thus we were offering no biomechanical services. This is still up to date, so these clinics have been closed for approximately 13 months. And we have had cancellation of all elective surgeries, especially with regards to the diabetic foot. With regards to patient appointments, when the podiatric services then returned fairly to normal, people were still afraid to come to the clinics because obviously they're afraid that maybe they will catch the COVID because of the people who attend the clinics, especially the vulnerable people, and they are the people we really want to see. So patients cancelled or delayed their appointments by months, resulting in severe cellulitis, overgrown nails, ingrowing toenails, ulcerations. We even saw maggots, something which we hadn't seen in wounds for a very long time, osteomyelitis, gangrene toes, and definitely an increase in minor amputations. And again, these are some pictures which we had patients presenting to us in this stage. We hadn't seen gangrene toes for a very long time in our podiatry clinics. We hadn't seen osteomyelitis, ulcers probing to bone again, as Professor Bolton pointed out, as they've seen in Manchester too, okay, because people used to come regularly to the podiatrist. But unfortunately, due to the situation, people neglected their health and their feet, mostly because of fear of attending clinics and because closure of clinics. So particularly at present, the COVID-19 pandemic, it is very important for us to try to, as much as possible, tell our patients that we need to avoid diabetes-related complications that would result in casualty, emergency rooms, visits to the hospitals. We need to avoid these as much as possible because our healthcare systems are already stretched and the resources are already stretched, and obviously we cannot keep loading anymore. Therefore, we need to resort to telehealth combined with home health, going to house calls, going to see visiting our patients, offering them the service, and other home strategies should be considered, especially by us podiatrists, to ensure good patient care. COVID has not only changed the way that we worked and the complications, it has changed us, the way that we need to present in front of our patients, do our exams with our students. And unfortunately, it has all stopped our traveling too. The only ticket that we all can purchase is a ticket from our maybe living room to our back garden and back. But hopefully, this will be over soon. So thank you very much. I hope that very soon we will be again sitting in large conference halls, sharing our experiences together. But for the time being, this is the way that we need to share the information between countries. Thank you very much.